Assalamualaikum, my name is Norina binti Siri. Today I want to give a talk about mental health. Mental health refers to a person's psychological, emotional and social well-being. It influences what people or a person feel and how they think and behave. The state of cognitive and behavioral well-being is referred to as mental health. The term mental health is also used to refer to the absence of mental disease. Mental health means keeping our mind healthy. Mankind generally is more focused on keeping their physical body healthy. People tend to ignore the state of their mind. Human superiority over other animals lies in superior mind. It is very important for people to keep both body and mind fit and healthy. Both physical and mental health are equally important for better performance and result. Do you know what causes mental illness? There is no single cause for mental illness. A number of factors can contribute to risk for mental illness, such as early adverse life experience such as trauma or a history of abuse. For example, child abuse, sexual assault, and witnessing violence. Next is exposure related to other ongoing chronic medical conditions such as cancer or diabetes. Third, biological factor or chemical imbalance in the brain. Fourth, use of alcohol or drugs. And lastly, having feeling of loneliness or isolation. What are the signs of a mental health disorder? Mental health disorder is in broad categories: anxiety disorder, mood disorder, psychotic disorder, personality disorder, and impulse control disorder. If someone you know experiences erratic thought pattern, unexplained changes in mood, lack of interest in socializing, lack of empathy, inability to tell difference between reality and fantasy, or a seeming lack of control, that person may have a mental health disorder. This is by no means a completely list of symptoms. Emotional symptoms of mental health problem. Mental health problem can cause a wide variety of emotional symptoms, some of which include changes in mood, erratic thinking, chronic anxiety, exaggerated sense of self-worth, and impulsive action. Physical symptoms of mental health problem. Mental health problems typically do not cause physical symptoms in and of themselves. Depression, however, can indirectly cause weight loss, fatigue, and loss of libido, among others. Eating disorder, a separate class of mental health disorder, can cause malnutrition, weight loss, ameorrhea in women, or electrolyte imbalance caused by self-induced vomiting. This makes eating disorder among the deadliest of mental health disorders. Short-term and long-term effect of mental health instability. In the short term, mental health problem can cause people to be alienated from their peers because of perceiving unattractive personality trait or behavior. They can also cause anger, fears, sadness, and feeling of helplessness if the person does not know or understand what is happening. In the long term, mental health disorder can drive a person to commit suicide. According to the National Institute for Mental Health, over 90% of suicide have depression or another mental disorder as factor. There are 4 types of mental illness. First, anxiety. Second, depression. Third is bipolar. Lastly, schizophrenia and other psychosis. Action step. First, stay active. Regularly physical activity improve one's mood, help relieve depression, and increase feeling of well-being. Try going for a walk, dancing, jogging, or riding a bike, and ask a friend to exercise with you if you need to be motivated. Second, develop a circle of friends for support. Next, identify what may be causing you stress. Determine what steps you can take to reduce stress, such as changing schedule, using self-regulation technique, and setting realistic goals for yourself. Fourth, talk to someone you can trust, such as a parent, doctor, counselor, religious leader, resident assistant, or teacher. Some people find that sharing their feelings with someone they trust and who recognize what they are going through help them feel better. Lastly, visit the health center and discuss concern with a health professional. If the health professional advise treatment, follow the instruction. Watch out for side effect and attend follow-up appointment to assess improvement. If you don't feel any better after 4 to 6 weeks, tell your health professional. Get a help for a mental health issue. It's important that you or your loved one should seek help to treat mental health issue. First, a physical checkup can rule out physical illnesses. An appointment with a mental health professional will usually include an interview and subsequent evaluation to determine the most obvious symptom and to ascertain the type and severity of mental disorder. In certain cases, an intervention may be required from family and friends. Conclusion: mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. That's all from me. Thank you for listening.